Good morning, everyone. Welcome to FYI Friday. So happy you are here today. I loved that starting song. Thank you, Allison. That was new to me. That was a great one. So happy you are here today. We would love to kick it off by doing intros in the chat. And so if you would like to share your name and your pronouns, and then if you would like, what are you looking forward to in May? So I will start. I am one of your hosts today. My name is Christine Rankin. I use she, her, or they, them pronouns. And I am really looking forward to going on a hike in the gorge this weekend to see the wildflowers. So found an easy hike to do, easy levels, and I'm excited to do that. So if you care to share, please do so. I will read a few from the chat. We have good mornings. May the fourth be with you. Looking forward to that. Um, let's see here. Working on getting a garden, friends visiting, looking forward to sunshine and picnics, morel hunting. Oh my gosh, that sounds wonderful. So many exciting things coming up in May. And I know the warmer weather is fabulous right now. So please keep sharing. Excited to see what everybody's looking forward to. And we will go ahead and move to the next slide. And we are excited to share our agenda with you today. And that is a picture from the photo booth at the conference last week. You know, some of you were able to attend, and that was so fabulous. So, more to come on that. I'm sure more reflections to be shared. But today for our agenda, we were going to do the intros, and then we are going to shift into some leadership slash fiscal updates. Then we are going to have a presentation from the Met Group. We will also have a presentation, Tetra Tech presentation, and then we will share some events and announcements. And also, we hope to leave space to hear what is on your mind. So we will go ahead and move forward to the next slide. And I believe I'm passing it to the fiscal dude, Zach.
Thanks, Christine. Hi, everyone. Good morning. Zach Owens, he, him pronouns, lead fiscal dude supporting the public health equity grants. I'm looking forward to more sunshine and longer days in May. Yes. Um, Conference. Thank you. Thank you for those of you who are able to make it and attend. It was amazing. Um, I was able to go, and just from a personal perspective, it gave me so much good vibes and filled up my cup in a way that I didn't even know that I needed. So thank you. And I think that if any of my colleagues want to expand on their feelings towards the conference after I finish this slide, by all means, go for it. Yeah. Anyway, business stuff, reports, activity reports and expenditure reports are due the 9th. That is a week from today, so please get those in. The 6-month extension notices will be coming out soon from your community engagement coordinator. So keep an eye out because we're going to send those emails with the letters offering you award extensions and telling you all of the what and how you need to do. But the main thing is that we will need a response from you as soon as possible because before we can actually start doing the contract amendments, we need a thumbs up from you in writing that you do accept the award. and that you want the funding. So again, that will tie directly to us being able to pay you when we get the amendments through. So look for something from your CEC within the next week or two, and please respond. April payments are in process right now. So our fiscal team just moved them over to our central finance unit here a couple days ago. So you should be seeing checks in banks within the week. So be on the lookout for that. And I'll turn it back to Christine and or anyone else who wants to add anything about the conference.
Thank you, Zach. We can definitely circle back to the conference. This was a lot of information. So the key points here, reports due May 9th. Extension notices are coming from your CECs this time. This is our first time in the process. So excited to send those out. And then April payments, you should be seeing those within the next week. The question in the chat, question on the report. Does the report limit you to only entering information on a max of 10 outreach activities? Anyone from the team want to take that? And if not, we can follow up with your question.
I'm happy to look into it, but I'm not sure of the answer presently. So I'll see if I can figure it out now, actually, while we're still meeting, and I'll put the answer in the chat if I figure it out.
Thank you so much, Jody. Appreciate you. Okay. Wonderful. Now we are coming up to the part of our agenda where we are welcoming our partners, the MET group.
Hey, could you please give Ziada permission to share screen? She made an edit, and so we
My
are
pleasure.
going to have her share. Thank you.
Well, hi, everyone. Do you want me to just jump in or do you want to introduce us?
Yes, perfect. Thank you so much for being here today. And I would love it if you would like to introduce your team, and we will pass it to you for this portion of the presentation. Thank you so much.
Thanks, Christine. Sorry, I sort of jumped in. Well, hi, everyone. I'm Maria Elena Campistegui with Metropolitan Group. My pronouns are she, her, ella. And with me is my colleague Ziara Gonzalez, whom you'll meet in a minute. And we've had, actually, I was looking through the list, we've had the opportunity to work with many of you already. So it's nice to be here with you. Thank you for the invitation. Metropolitan Group is here to support all of you in 3 different areas. We offer custom technical assistance in communication, we've been doing a lot of resource development recently too, just given the times and what people are requesting. And resource development very much connects to communication because you've got to reach out and engage different potential donors, right? And then transcreation of materials from English into many different languages. So many of you work with varied communities. So if we're able to provide you with any kind of assistance, all you have to do is just send an email with your request, and we're there. And there's lots of organizations that we're currently working with. So you have Ziara's email there. The second area, if we can go to the next slide, is planning workshops and convenings. And those are based on what we hear. Hey, Ziara, can you pass the code? Yeah. Those are based on requests. Like people, like in each session, we do polling and we really learn from you in terms of what would be helpful. Something that we've really been, I just mentioned this, we've been really hearing about is resource development workshops. And so what you see here is some upcoming ones, and we're going to send you this PowerPoint so you have all this, and all you have to do is click on the link to register. But Fundraising fundamentals 1 and 2 is the same content. It's just that if you're just starting out, chances are your questions will be different. And so we've structured 2 different ones so that if you've got more experience, you can come to fundamentals 2. If you're just starting, it's fundamentals 1. And that way we're ensured that you're really getting the kind of information and support that you need. Coming out of that, then in the 21st, it's fundraising applications where you've been maybe thinking about it, trying some things out. It'll be more of a hands-on opportunity to bring some of the things that you're challenged with, or things you need to sort of some help in tweaking. And then the last one, Ask a Fundraiser, is come and ask anything you want, any other kinds of questions. So we're really trying to provide you with a range of support and services. We've got Introduction to Storytelling also coming up. The other thing that we do is we've been working with some of the different programs so that facilitating program-specific convenings and emergency preparedness is coming up. That particular session is going to be on some of the systemic things that all of you are doing. There's some fabulous work being done out there in this particular area. So this isn't to duplicate anything that the programs do. Oftentimes we'll plan these with the programs themselves. The third area that we're working on, and I'm going to pass this on to Ziara, is the launching of a little microsite. So it's been a lot of these sessions are recorded. There's lots of materials, and it's very sort of like a tedious process to be sending things over email. And so we've created a little mini resource site that you'll be able to go in and access a directory of different organizations that you might want to partner with, some of the upcoming workshops and events, and you just click on it and sign on, and then a resource hub with tools and materials and helpful information. So Ziara, I'm going to pass it to you to walk people through it.
Thank you, Maria Elena. So as Maria Elena mentioned, this microsite is going to be available for you in the coming days. The content includes a directory of OHA funded community partners. It doesn't include your specific emails, but it does include the list of who are these organizations and what are the areas they're working on. As Mariana mentioned, again, upcoming workshops and events such as this one, and a resource hub where you can find all the past events and materials. To access the microsite, you just need to click this address. This is going to be shared with you as well. So this is a screenshot of what you're going to find. It's really simple to navigate. Once you get there, you're going to see information in Spanish and in English. It's going to be bilingual. Right now, you're seeing only the Spanish because the photo is a little bit smaller. You're going to see the welcome. You're going to be able to click in the parts that are a little bit lighter. And once you click there, you're going to be able to access the documents. In the right side of the screen, you're going to find key and important dates. For example, the upcoming workshops that Marielena just mentioned, you're just going to see the dates, and you can save these dates directly from this microsite to your calendar. And if you want to register, you just need to click to copy and paste that Zoom registration link. So as I mentioned, know what sessions are coming. The key dates are the sessions that the LHA team is hosting. So you can copy and paste that link, and the upcoming other workshops are down there. If you will need to find a resource or maybe copies or even the recording of past convenings that we have hosted, you're going to be able to see them here in the resource hub. OHA has a YouTube channel where all of the FYI sessions are being uploaded. So if you click in this link, you're going to be able to get into that YouTube channel. And not only you're going to find these sessions there, you're going to also find the sessions that MG is hosting. To access the documents or the materials of these past sessions, you just need to hover your mouse over the name of the event. For example, identifying, growing, and cultivating supporters. This session was done in 2024. Once you click there in that blue area, you down below you're gonna see all of the materials available to you. The worksheet in Spanish and English, the PowerPoint presentation in both languages, and the video recording as well. But once you click there, the document is gonna download in your desktop or your finders. This is the same presentation in Spanish. I don't know if we have time, so I can go over it in Spanish if that's helpful. Just let me know, and I can do it. Ashley, do you want me to go over in Spanish or Jody or?
I think it would definitely be helpful.
Yep, awesome. Okay. Como María Elena mencionó, vamos a hacer unos talleres y unos workshops próximamente. Y parte del trabajo de MG es proveerles asistencia y apoyo personalizado a todas las partners o todos los socios colaboradores de OHA. Dentro de ese apoyo personalizado podemos ofrecerles diferentes proyectos de comunicación o estrategia de comunicación, desarrollo de recursos, creación de materiales del inglés a diferentes idiomas, no solamente el español. Tenemos un equipo de socios de la comunidad, personas de la comunidad que hablan múltiples idiomas, no necesariamente el español, puede ser árabe, ruso, un universo bastante amplio. Si tienen alguna duda o pregunta, pueden enviarme un correo electrónico. Entiendo que puse el correo electrónico en el chat y lo pueden ver ahí. Esta es la lista de los próximos talleres y las sesiones. Como ven, en una columna está en español, en otra está en inglés. En el website que les presenté también está esta misma lista de talleres y van a poder ver la descripción de los talleres. Y en un minuto les voy a enviar, una vez que termine esta sesión, voy a compartirle al equipo de OHA una lista completa con la descripción de cada uno de estos talleres en ambos idiomas para que lo tengan accesible. Como les mencionamos, el micrositio que estamos trabajando es para ayudarlos a ustedes a continuarse manteniendo conectados y que tengan acceso a la información que se ha discutido en diferentes talleres, no solamente en estas sesiones de los viernes, sino en los pasados talleres que MG ha me olvidó la palabra en español, ha presentado. Para acceder al website, esta es la dirección. María Elena compartió la dirección en el chat. Para navegar el website, una vez que entren a esa dirección, esta es la página inicial que van a encontrar con una bienvenida. El contenido está en ambos idiomas. En la sección que dice Key Dates, van a ver el enlace para registrarse en las sesiones de FYI Friday. Para poder registrarse tienen que copiar y pegar el enlace en sus pantallas o en su buscador y pueden acceder a la información. Y aquí está la lista de las próximas sesiones o talleres que Metropolitan Group va a presentar. Lo divertido, lo accesible de este micrositio es que si lo quieren añadir a su calendario, simplemente tienen que darle clic a Google Calendar o Universal Calendar, que puede ser, por ejemplo, Outlook, en el caso de aquellos que tengan Outlook. En el centro de recursos van a poder tener acceso a los materiales que hemos presentado en los pasados talleres. Simplemente con el cursor marquen el tema que estén interesados o el taller que estén interesados y se les va a abrir una pantalla en la parte de abajo con todos los documentos. Tienen que darle clic al documento y el documento va a descargarse en su pantalla o en su computador. Muchas gracias.
Thank you so much. And I'm going to pick up screen sharing. Thanks, Christine.
can I just say that this is not a website, so it's a really simple, mini little site, so don't expect big things, okay? Lo digo en español. Esto no es un website, mini sitio chiquito, así que no esperes gran cosas del sitio, simplemente para llegar a la información. So, thank you for having us.
Muchas gracias.
Thank you so much, Met Group friends, for being here today and for your presentation and offering it in both English and Spanish. We deeply appreciate you and all that you do. I don't know, colleagues, if I missed anything in the chat or questions. If I do, please let me know. But I think at this point we are ready to move into our next piece of FYI Friday, which is the Tetra Tech presentation. And I will hand it to my fabulous colleague, Jamie, I believe is taking this.
Indeed.
Yes, perfect.
Hi, everyone. I'm Jamie Bash. I use she, her pronouns. I am bilingual, but rusty, so I'm fine with Aya as well. And I come to you from the Oregon Health Authority's Health Security Preparedness and Response Program. That's a mouthful for saying that we're the program that helps respond to outbreaks and disasters that have a public health or medical component to them. And I do communications for that team. So a lot of times you don't see my face. I'm very much in the background supporting local emergency managers and public health communicators and getting out health information to their communities and advising them. And some of that's developing some pre-scripted materials. Sometimes some of you may have participated in the Oregon Alert process of developing some templates. And I think we received a lot of feedback in an emergency preparedness and response space around communities' experiences during COVID and the wildfires. And we've been starting to work through some of those general big, like systems-wide issues. But I want to get OHA a little bit back into our public health space and give it some attention. And so one of the things that I'd like to do is I think we've had a lot around emergency kits. We see Office of Emergency Management increasing community engagement. They have an upcoming webinar actually in May that I'll get to this team for older adults. So we're seeing progress there. And one of the things that I think we're still missing from the OHA perspective is how do we move past kits? What's the information that is specific to health that people need in disasters that kind of moves us past the basics? And so I'm going to be working with Tetra Tech. They aren't able to log on until 11:30, so I will introduce Sarah when she gets here. But basically what they're going to be doing is helping me figure out what are those cross-cutting themes in disaster preparedness and response that are specific to health that people need to know about. And part of the reason we wanted emphasizing cross-cutting themes is because our crisis and emergency risk communications toolkit with the translations is approaching 2,000 documents. And I don't have every disease covered yet. I don't have every disaster covered yet. And that's unsustainable for one person to maintain. And so I really want to get at those root, what are the things that are going to apply across every hazard, or at least most hazards that people need to know about their health. So if you want to go ahead and advance the slide, when Sarah gets here, I'll let her dive in a little bit more. But initially, we'd like to focus on the African-American community, and we have done some with the immigrant community already, and yet it's yielded a lot of that general information kind of results, which is great if that's what the community needs. But it's been a little while since we did that engagement. And so now we want to look, broadly as well. So right now I've handed a lot of documents over to Tetra Tech, and they're looking at them, kind of digesting all the information that I gave them about what's happening in the state any engagement that we've had at OHA with community around disaster preparedness and response. And they're trying to figure out what the gaps are and what the strengths are so that we don't repeat what we've already done, but are really filling in those critical gaps. And then they'd like to run a survey. So they'll be working on some questions as well. And then they want to go ahead and do some listening sessions. And so I think that's one of those spaces where you can really help provide some input. You know, as grant funded partners, it's just something we wanted to invite you into the space on. We know that you're working directly with community. And so we fully anticipate that as we hear from community through the survey and the information sharing sessions, that we would come back to this group and present those findings in case it shapes any of the work that you're already doing around emergency preparedness and response. I know some of you got funds specifically for that work. And so, you know, at the end of the project, they'll have some analysis and a report for us that we can come back to you with to help inform your work and my work as well. And I don't know if Sarah, we have like 3 or 4 Sarahs on this project, by the way. So those names may become important. Or if you miss somebody's name and want to take a good bet, Sarah's probably a good bet. But has Sarah joined us yet? I know I'm a touch early on ending this.
Sarah Van der Kapellen
Yes.
has joined, and Sarah Bannister. And
Hi.
I apologize for me stumbling on the name. Doing my best.
Thanks. So Sarah and Sarah, I was just telling them that we have lots of Sarahs on this project. And so if folks wanted to take a stab at who they might be talking to, Sarah's a good bet. And, but I do want to give you a chance to come on camera and introduce yourselves as well.
Great. Thank you for having us. My name is Sarah Van Cohen. I am the project manager on the Tetra Tech side for this. And then I have my colleague, Sarah Bannister, also on the call. Thank you for accommodating us. I know your meeting started a little while ago and we both had conflicts, but we really, really wanted to join today and start talking about this project and how it's really important. So Sarah, did you want to say anything else before we get started?
No, Jamie, I think that was a great introduction. I was able to hop on just a few minutes ago, so I think I caught most of what you said.
And I did, Sarah, since you were just jumping in, I did kind of briefly talk about the project and kind of the tasks.
Okay.
But if there's anything else you want to add, please feel free to.
Okay. I just joined, so do you want me to run through the slide, or is there anything specifically that you want me to address?
I think we've covered that the slide pretty well. I think if there's anything that maybe wasn't printed on the slide that you planned on adding, I did touch on why we're doing the project a little bit. So maybe I think the only gap then is maybe who is Tetra Tech? And I didn't tell folks that we selected you because you have deep experience in disaster communications. But if there's anything you want to share about Tetra Tech.
Sure. Our team is nationwide. Sarah and I work on the emergency management risk and resilience team. Our team is, Sarah is based on the East Coast, in Southern California. Everyone on our team has a different background and skill set that they bring to different projects. And so as we get new projects, or chase new work, we're always looking to put the correct people on projects. And so my background, I'm PhD in infectious disease epidemiology. So I tend to focus a lot on public health projects, and also a lot of what I do is continuity planning. So that's where I find my intersection of a lot of my work. And then Sarah Bannister and I have worked a lot together on different projects, especially in these community-based projects that touch on public health and language and access to services and needs. And so in this project, we're really excited because we, as Jamie probably already told you, the timeline is really short on this. And so what we've been doing in the last week or two is really looking through a lot of the documentation that was provided to us and doing some research on what's already existing and what we already know within this state. And then where maybe are the gaps in what are the themes that are cross-cutting for public health that are of interest to the community. And so we are we've drafted a survey, an online survey for review. It's going to Jamie today. And a lot of those themes, we have probably 5 different sections in that survey. It sounds long, but it shouldn't be very long. And it's really pointed at the first section really looks at just the background and the information, preliminary user information, whoever's completing it or completing it on behalf of someone. So we'll ask about some of those questions. And then we start to get into community and healthcare, that community healthcare questionnaire. We ask about questions about transportation and community resources and healthcare system access in your environment, housing, medical medications and equipment, preferred language for messaging. So all of these different topics touch on your access to care and public health services. And then we'll ask also about messaging and engagement practices for public health risk communication. So we'll ask what format user, the community, the user meaning the survey completer, but really the community members, how do they prefer to receive messages, right, from public health? And what's the format that they want those in? What's the how do they want that? Do they rely on direct communication, right, coming directly from a public health agency? Do they like it indirectly from maybe within the community? Those types of things. We'll also ask about what's their preferred engagement with public health initiatives specifically. Do they like focus groups? Do they like forums? Do you like web surveys, phone-based questionnaires, those types of things? How do you currently receive information? What do you rely on? What type of information do you rely on? And then we'll ask also about their opinions, everyone's opinions on barriers to communication, right? And receiving information. Do you want to receive additional information, right? Some people want more information. Some people don't want more information. What topics? And then in that list of topics, we've included in that survey a lot of different topics that we're proposing different topics, right? That we think the community might be interested in. But then at the end, and this is always Sarah's recommendation, is that we have an open-ended question where if we didn't meet the mark on any of those, and you can go through the whole, all those questions and say, no, none of those. And then you can put that in yourself of what is it specifically that you're interested in, or your community, that your community is really interested in. And so we'll gather that information in there. And then the last section is the required demographic information. So we'll ask users of the survey to complete that information also. But then the basis of that is also those surveys are really going to be the basis for the listening sessions. So the listening sessions they're listening for us, for my team, right? So they're informational sessions where we're going to ask community members to give additional information, and we can bring up information that we received, the data that we collected in those surveys, and then ask for additional information. And so that will really help also inform that summary report. As we go through at the end, you'll see we'll analyze the surveys. We will conduct the listening sessions and the information sharing sessions, and then we will develop a summary report that then we'll provide to Jamie for additional follow-up. So what we're asking of the community is for their knowledge, their attitudes, their practices, their beliefs on cross-cutting public health priorities and messaging needs during, and then also just right at, after an emergency. So just really a lot of input is what we're looking for. And then everyone always wants to know, what's the time commitment, right? How long do you need us for? So I put, Sarah and I are thinking probably about 75 minutes for community members engagement. So we're thinking about 15 minutes for the survey. And then, like I said, the survey is intended to be very to the point, but also allow users of the survey to add additional information as needed. And then we're asking community members to participate in those virtual information sharing and listening sessions. So, Sarah, did you have anything else to add on that? Okay. Jamie, I think that's it for us.
Okay, thanks. I guess just does anyone have questions for us? Or even initial feedback? All right. I guess I'll hand it back to the hosting team then.
All right. Thank you, Jamie and Sarah and Sarah. Appreciate you being here today. And we'll go ahead and move into events and announcements. Next slide, please. Okay, the first one that we wanted to share with you all is from the READ group, and this is for tobacco prevention stories. We know we have a lot of wonderful grantees doing tobacco prevention work. So if you are interested in an interview that you would receive compensation for, please check out our follow-up email. We will have information on that if you would like to get involved. Also, it looks like Ria has dropped in the chat information about it as well. Thank you so much, Ria. And we can go to the next slide. So the next event we would like to share about is OHA is offering free lead checks for soil, toys, pottery, and spices. So it appears there are a series of events in different locations where you are able to get your items checked for free lead checks. And if anybody from the team or anybody from the crowd has anything to add to any of these events or announcements, feel free to unmute, raise your hand, put it in the chat. So, all right, we can go to the next one. And next up, we have disability awareness training. This one is Thursday, May 8th. And this is in partnership with Central Oregon Disability Support Network. Do we have anyone here today that would like to speak to this? And if not, it's okay. And okay, well, we will have all this information in follow-up slides. And if we could actually move back one, I'm sorry. On the lead checks, I believe I may have a colleague who would like to share a little more. If you would like, please unmute. Okay, maybe not. All right. So next up, we have doula's training course in Spanish. This is coming up on May 12th. And I don't know if we have anybody that would like to speak to this a little more. Okay, we're just getting the information out there today. So lots of great events coming up. We also have free Hep C testing. Join the wave to eliminate hepatitis C on the coast. And this is May 19th. Astoria, Seaside, Newport, Coos Bay, and Brookings. So a lot of locations there as well. And we moved through those pretty quickly, but I know we want to save time for what is on your mind. And so if you have any reflections or events or thoughts, now we have time to do that. I think we could stop sharing. And I see Dr. Sandra's hand up. Good morning.
Hey, good morning. Everybody has been quite quiet today, right? But wow, beautiful weeks. Lots of things that we have done the last couple of weeks all together. And thank you for providing all of this. And the information we got this morning, quite interesting and good. So, Christine, also, wow, we have done a lot of advocacy. That's why you have been quite busy March and April, right? And more in May, I still. Anyways, Doulas Latinas International, we are preparing also the conference that we have been talking a little bit, but now it's more shaped. It is Humanized Birth as Reproductive Justice, and is a not luxury at Doubletree or any place like this. It is going to be in Gresham, but it's really for doulas, community health workers, peer support, all THWs and professionals, right? Health professionals and us. So we are already placing this week the link. So I don't have the link to offer yet, but I'm going to put some information in the chat. It is June 14th, all day Saturday. So should make it easier because that's what we want to make sure really that THWs can come. That's the idea. And and lots of fun and good workshops, and really the proposal is going to be a day of reflection. What really is reproductive justice in our state, our communities, and how humanize birth, better birth outcomes and health. It is important in this process. That's it. Thank you.
Thank you. Thank you. Thank you for sharing. It's exciting. And it looks like we have some more information in the chat. Kim, thank you for adding more information about the lead checks. Deeply appreciate that. We have another hand up. Is it Lung?
Hi, yes, Christine. So
Welcome.
thank you.
Good morning.
Good morning. Yeah, good morning, everyone. I would like to share the upcoming training. Sorry, my name is Long Lizum. I'm a community health director from East County Community Health, which is initiated from Rocco CDC, and we have a training coming up. May 13, we collaborated with the American Cancer Society to provide cancer awareness to become the program called like Health Equity Ambassador Program. So we would like to invite whoever wants to get involved in their community to give like a cancer awareness, including prostate cancer, breast cancer, and another 2 type cancer. I think colorectal cancer. So like we are providing an education about the cancer and also like how to help the community with those knowledges. So and I'll put the full information in the chat after my conversation with you. So yeah, sorry about my camera. I have to close today. So I'm work from home, and then yeah, I would like to share this training opportunity to everyone, and we will provide breakfast, lunch, and after the training, and we will provide a continuing education unit like 4 credits to all of us. Yes, thank you.
That is so exciting. Thank you so much for sharing
Thank you.
about the event. Yes, that is really exciting opportunity for training. And I see Amy, a hand up. Please go.
Hey everybody, it's Amy from FACT Oregon, and we are doing 2 virtual trainings. It's a 2-part series in emergency preparedness for families navigating disability. The first one is going to be kind of like a learn and plan, where we talk about the types of emergencies in Oregon, how they could affect your family. Then having families thinking about their child's unique needs, from like mobility, communication, sensory mobility, medical issues. Then kind of what it takes to build a step-by-step emergency plan, and then resources in the community. And then the second one, which would be a week later, and these are both during the lunch hour, is that we're going to have families use an integrated support star to start building their plan. And so these are virtual, and they'll be available across the state. So I put information in the chat, and please join us.
Thank you, Amy. Thank you so much for sharing. Anybody else want to unmute today and share any thoughts or reflections, maybe from the conference or anything at all?
Hey, Christine, Ines here.
Hi.
She, her pronouns. I am not on camera today, and I've had to hop in and out of this call, but I got a little note that folks were talking about the Central Oregon Disability Support Network Disability Awareness Training. So I wanted to hop on and give another plug for that and say CODSN, I don't think is in the Zoom room today, but they have been working on this training that is a general disability awareness training. So a great primer on some of the basics, a little bit of history. They will have a panel of self-advocates joining to answer some questions, and that is next week on the 8th. I believe it is 11 a.m. and it's sort of I think should be a great learning opportunity. And yeah, would love to share that space with folks. Thanks for letting me hop on to plug it again, and excited to see all of you in this meeting. My conference highlight is that it was great to be able to hang out with people. And I always feel really lucky when work feels fun, and it felt like we were hanging out and getting to chat and share things and come up with new ideas. That's all from me. Thanks for listening.
Thank you, friend. Thank you for sharing. And thank you for adding that context for next week. I deeply appreciate it. And is it Jamila? Please, if I didn't say your name correct, please correct
Oh, it
me.
was perfect. Thank you. Yes, I just wanted to hop on as well to promote. I put in the chat, United Way of Columbia Willamette in Central Oregon, in collaboration with the Disaster Resilience Learning Network. We're hosting a community resilience webinar, really focused on, it's called Prepare to Prosper, sort of taking a different perspective to how we engage with emergency preparedness. So we have brought in Anna Marie Jones, who is a renowned resilience expert of the last 30 years, really preparing nonprofits for what it means to tap into the skills and resources that already exist and how that can be applied when navigating and preparing for disasters. So we're really excited to share Anna Marie as a resource with all of our partners doing this work. The link is in the chat to register. It is on Wednesday, May 21st, from 1 to 2:30. So after you attend the second part of the training that another colleague shared earlier, also on emergency preparedness, is a great way to continue that day with really tapping into resources that we have already accessible to us when navigating disasters. And in addition to Anna Marie, we'll have folks from Trauma Informed Oregon revealing their self-care toolkit, specifically around emergency preparedness. So really excited about this day. I want to get as many folks aware and register, so please share with your networks. Thank you.
That is a fabulous collaboration. That's going to be so fruitful. Thank you for sharing that. Jody or Ashley.
Well, I'll go ahead and go if that's okay. I'm Jody Anderson. I'm the communications lead on the community engagement team, and I use she, her pronouns. And I just wanted to mention that I put a link in the chat for a way to submit any sort of events or opportunities to the CET Highlight newsletter. There's so many amazing events in this list, and I can't put them all in the follow-up email for the grant because I wouldn't be able to get the email out to you folks like very often at all. But the highlight comes out once a month right now, and that's a really great way to kind of to boost your folks' participation in these events. And I'm super excited about it all. I will also send that link in the grant email though. So if you don't copy it right now, it'll be in the follow-up email that comes out next week after this session.
Perfect. And I just wanted to make sure because there is so much good stuff in the chat to show folks how to save the chat in case you don't know. So here I have the chat open, and if you click on these three dots to save chat, it will then save to your computer and you can reference those links and you don't have to worry about scrambling to copy and paste, which I have done before. So thank you.
Yay, Ashley, thank you. You know,
Thank you.
Christine,
That was so
hey,
helpful.
Shiloh.
I never knew.
I just want to complete one thing, if I can, because we have just a couple of minutes. How important and good was the conference that we worked all together last week? I want to shout out that, Dolly's not here today, but we are all here. And it was amazing. And we know the amount of work and advocacy for funds and for everything to make sure we still and we would have and keep our conference. And it was an amazing day of a meeting. Hey, hello! I have seen you in the small square of the chest. Oh my gosh! Yes, remind me your name. Was that the day all day long was something like this? So I just want to say the importance. We know, unfortunately, many people couldn't come or couldn't join for any reasons. However, it is important that, and also I feel that I feel myself enough for all the challenges that we have ahead. That's it, hurts and everything. So I think Karima, Shiloh, Ashley, Jody. So we all there, Christina, we were meeting there and hey, Erin, yes. So we have beautiful pictures, right? Yes. So much love. Yes. Gracias. Thank you. Obrigada.
Yeah. Got me emotional. I love that. I love you. It was just, we were just talking yesterday. It seems so long ago. It was like just filled our cup up. It's like it just was so special in so many
We need
ways.
one every 6 months.
Yes, Shiloh.
Just to keep us going.
Wow.
It was wonderful. I was absolutely honored to be a part of it, and it was really rewarding.
Let's get ready for the trip. 2025 has a lot coming still.
We will continue to build community, and I know Dolly would love to hear these words today. I know that she fought hard to make sure that we were still able to have this, and she never gives up. And bless her heart, she takes everything very to heart. So you know, it's her passion. It's all, we all feel it together. It's a collective passion for this. And so when we have the chance to come together like that, like when I have my really shitty days, I just reflect on that and think, wow, like I'm gonna get through this okay. Like we're gonna be okay. So thank you everyone for being here today. I know we're almost at time. It's been such a good meeting. This is
Yes,
that is
a big
like next
hug.
level now. I
Hugs
love that.
to everyone. Yeah, like, oh my gosh, take a picture of that. Okay, next picture, everybody make a hug.
Yes, we need a planned screenshot. I
Hey,
don't know how to do
Jody.
that, but
Even Jody is entering this. Wow. Gracias.
oh
Thank
my
you.
God.
Allison, you were there. Good. Hey, ciao.
Thank you, everyone. Have a great weekend.
Bye all.
Bye. Take care.